A head is a terrible thing to waste. A human head is the same approximate size and weight as a roaster chicken. Many of today's heads have been around a few days and have dried out. Injection of saline is used to freshen them up. With more and more cosmetic procedures being done endoscopically, by introducing tiny instruments through a series of minimally invasive incisions, knowing one's way around the anatomy is even more critical. With the older techniques, they peeled everything down and they could see it all in front of them. Now when you go in with a camera, you're right on top of something. It's harder to keep yourself oriented. When surgeons are residents, they typically do not practice on cadavers. Instead, they learn by watching surgeons at work. The first operations under ether did not take place until 1846. Surgical patients in the late 1700s and early 1800s could feel every cut, stitch, and propping finger. In 1687, the King of France was surgically relieved of a painful and persistent anal fistula, and was apparently quite grateful for and vocal about his relief. Before this, barbers and surgeons were considered to be equal. Before there was consent forms and lawsuits, patients did not realize what they might be in for when they underwent surgery at teaching hospitals. While patients were under, a surgeon might have invited a student to practice an appendectomy even though the patient did not have appendicitis. Nowadays, medical schools hire educators who allow the students to practice on them, and they offer feedback. 73% of parents of newly dead children, when asked, gave consent to use their child's body for teaching intubation skills. Malar fat pad is a cushion of youthful padding that sits high in your cheekbones. Over the years, gravity essentially pushes down the malar fat padding, causing the parentheses frame around your mouth